going to get started. So we'd like to welcome everybody here today for our NAACP Santa Rosa-Sonoma's COVID panel that we're having on the vaccine for children, but also to answer community questions regarding COVID. So we have with us today, we have Dr. Aaron Sanders, we have Dr. Brian Patowski, and we have Dr. Kismet Baldwin. So they are here to present information that they have been working on to present to you, to provide as much detailed information to kind of provide you with a lens into what is happening now and how getting the COVID shot or providing it for your children will support your family and the community. So we will start off with, I think, Dr. Brian,
Dr. Baldwin, did you want to start with giving us some of your kind of public health perspective numbers as an overview?
Yeah, we can start there. So, I mean, just as a level set, so I work in the public health department. And so I'm not, as a doctor, not seeing individual patients. We feel like the county is our, everybody in the county is essentially our patient. So we're looking at a kind of a higher level, not the individual level for COVID or really any other illness, disease, issue that's coming up. So just keep that in mind. I'm gonna zoom through most of these slides, but I can send them to Pearson or Ndinga, and anyone can have them. They really are public data. So, and most of these are coming from our website, which is a really good way to look at the data. So, just as looking at it from again the county level, looking at our new cases, our overall test positivity, hospitalizations, and we're always looking at the HPI-1 or lowest HPI quartile. And basically that quartile, that's the 25% of zip codes in our county, in Sonoma County, that have the least access to medical care or resources or food. I mean, that's it's an important, group or population to look at. We want to make sure that they are not continuing to be disproportionately impacted by COVID. What are we doing to address that? What's the test positivity in the lowest HPI, and really direct a lot of our focus to areas that don't necessarily have the resources or the access or the means to either get treated or tested or vaccinated, whatever it is. So as of today, our overall case rate is 8 new cases per 100,000 residents per day. If just as a comparison, back in June, we were down to around 6 or 7. So again, we saw a spike after that due to the Delta variant, and then we started to come down, and then it kind of went back up again, and now we're kind of hanging around 8. And our test positivity for the overall county and for the lowest HPI quartile are around 3. We want them to be lower, but we also want them to not be a large difference between the two. And so we like to, break it down. And if we're looking at, case rate by race and ethnicity, this is over the last 60 days. And this is just a snapshot of, what our epidemiologists send to us every week. And let me put this in presentation mode. It might be a little bit bigger. So again, since October 25th, everyone's kind of hanging out around the same area, which is good. We don't want to, see large differences amongst race and ethnicities. But if you look at African American, which is the blue color, it's right around here. And I think a better view is on the right-hand side. The case rate is about 6.2, which currently is the highest for any of the race ethnicities in the county over the last 60 days. And what that's looking at is the number of cases divided by the proportion that race or ethnicity makes up of the county. So think of it that way. It's not that African Americans have had more cases in the county, because it's actually a small percentage of the overall population. But based on the number of African Americans or Black people in the county, it's they've got the highest. We've got the highest case rate. If you're looking at it spatially across the county, this is overall for the whole county. Where are we seeing the most number of cases and where are we seeing the highest case rates? So again, a lot of times focused in the Santa Rosa area. The lighter the color, the hotter it is, and the more cases that we're seeing. When you break it down by race and ethnicity, this is, again, a little hard to see, but say for Latinx population, you do see it really heat up in certain areas. So we know where more cases are. But for most of the other race and ethnicities, you're not seeing one central hotspot. It's kind of distributed across the county. And then when you look down the lower right, this is white, and that's the bulk, not the bulk, but have a large percentage of the population. So this makes a lot of sense. Again, this is case rates for the whole pandemic versus the last 60 days. And if you look over time throughout the very beginning, since the very beginning of the pandemic, the Latinx population has definitely had the highest case rates. But again, in the last 60 days, we're seeing a little bit of a shift where American Indian, Alaskan Native really are our highest. And if you look at African American, which on this slide is orange, kind of in the middle of the pack here. This is just the ages over time for cases. Again, not over time, but over the last, since October 4th. In the beginning of the pandemic, it was definitely the older population, 65 plus, 70 plus, that was the bulk of the cases, but we really have seen a shift over time. And certainly with the Delta variant, we're now in, 30 to 49-year-old age range is where we're seeing the most number of cases, and we're seeing increases in the pediatric and the younger groups up to 29. Vaccinations, we're about 74% of the eligible population of the county is fully vaccinated. And when we say eligible, that's 5 years old and above. That's who's eligible to get the vaccine. So that's what the slide is showing. And then when we break it down by race and ethnicity, you can kind of see partially versus fully versus not vaccinated. And if we're looking at the African American population, actually it's a quite a good vaccination percentage of fully vaccinated, around 77%. But then when we go down to multi-race, which is a black hole for us, honestly, we don't know who's making up that multi-race. Everyone's allowed to choose, what they, identify with. There's a much larger percentage that is unvaccinated, and we're trying to figure out exactly what that means. And that, frankly, are having a little bit of a hard time nailing that down. And I'll be very quick on this one. So we're also looking at 65 plus for the boosters. We want everyone to get their boosters. Everyone over 18 is eligible to get their boosters now. But, again, when we're looking at death and hospitalizations and severe illness, the 65 plus age range really has the highest risk. So we are looking for the boosters, trying to get those percentage rates up for vaccinations. But again, looking at the Black or African American population, about 51% are eligible. Well, of the eligible population, 51% are eligible, but 49% have received their boosters. So we really would like to continue to see more people 65 plus across all demographics get their booster shots. And again, looking at the HPI-1 versus HPI-4, HPI-4 being the most healthy community conditions, we want this to be better. There's quite a gap here in 65 plus getting their boosters between HPI-1 and HPI-4, and we've got some work to do to lessen that gap. And this is, again, one more time, the breakdown of race and ethnicity for the 65 plus. So that's kind of an overview of what we're seeing and what we look at from week to week in the county. One last couple lines on Omicron. We're not really sure. We have not identified any cases of Omicron in Sonoma County. I think everyone's seen that there was a case in San Francisco. This was someone who traveled from South Africa, came back, did the right thing, kind of stayed at home. And then when she saw this news about it, actually alerted the health department in San Francisco. So with all good things in place, this person would have been missed, not missed, but just not identified. So this, thanks for that person coming forward. But I think we can assume there's more Omicron than we know right now in the United States and probably in California, but it's going to be here. It's only a matter of time. Preliminarily, it looks like it's been pretty mild cases of COVID in South Africa, but that's, which is great. That's, preliminary information. We'll keep on top of that along with the state health department to see how that pans out. There's a pretty low vaccination percentage in South Africa. So not sure if that's playing into it as well, but people who have been vaccinated have gotten Omicron thus far. So we'll see where it goes. There's some concerns, but we don't know how it's going to go. The big thing is to keep getting vaccinated, get your booster. That's going to give you the best setup when Omicron comes and get us in the best place once it hits Sonoma County. I'll leave it there and just take it away.
That was awesome. Thanks, Dr. Baldwin.
Do you want to answer questions as we go, or just I can answer it now, or we can wait? I'm not sure how we want to do this.
I think let's go ahead and present the information,
Okay.
and then we can open for questions later.
Sounds good.
Okay. I see Regina wanted to talk about boosters. So are you sure we should? What do you think?
Oh, yeah, go for it. This is actually a candid conversation, so go for it.
Yeah, Regina. I think I always feel like I'm one of those people who, like, if I have a question that's like on the tip of my tongue, it's hard to listen until like somebody addresses it. But since we're all here, this is in some ways nicely informal because we're not a big group. We want to make sure we answer all the questions for sure. That's like the main reason I feel like why we're here too. So, it sounds like maybe Regina's question, Regina, maybe you could say it, make sure I'm hearing you right. But it sounds like maybe this question of like, when do the boosters end? Is that kind of the...
Exactly. I can just see that we're going to be doing this for some time, and that's scary.
We could be. I think we're in the unknown, and Aaron or Brian, and everyone can call me Kismet. That's fine. You don't have to call me Dr. Baldwin, but we're in the unknown here, and we don't know how many times we're potentially going to need to get boosters. It could be where it ends up like a flu thing, where once a year we're always recommending you get the flu shot because there's enough of a change in the flu virus that's circulating that we really want people to get another immune boost essentially for that season. But we're not really sure. I think the hope is that we get to a point where there's enough people vaccinated and there's enough immunity that it kind of mellows out, I think, for a little while. And then maybe it's an annual thing, or maybe it's every few years, or maybe it's like, your DTaP or TDAP, where you wait a few, years and you have to get it, but we really don't know. And I can understand how it certainly is concerning. We don't want to have to do this every 6 months or something like that. That would be a lot, but we'll have to see.
Yeah, I agree. We're somewhat in a race right now. I think we did have a chance, maybe a year and a half, everybody get vaccinated globally, maybe we could reach herd immunity, but that wasn't the case. I think going forward, it's just going to be a race between the virus and our scientists. All viruses, including the flu, would change. And each year, our scientists are putting their brightest minds to make sure we had a good flu vaccination. But I could see this happening with the COVID virus. It's somewhat going to be here to stay. But the lower the infection rate, more people getting vaccinated, the less chance of this virus to mutate going forward.
And Regina, the other way that sometimes I talk to parents about this, and I'll kind of segue into talking about kids as a pediatrician. But one thing I sometimes talk about is like layers of protection. So we know over the last year, we've been focused a lot on masks, on hand hygiene, and trying to make sure that we're keeping a safe distance from each other. That was kind of like layers of protection. Then the vaccines came around, and it was like, and then the boosters came around, and each one of these is like a layer. But I think that one thing to remember, or one thing I tell parents to think about, is that it's not that when you like you're adding additional layers. So like, I don't know if like, one of the things that I think Omicron last week in the news, I think scared people, as I think Kismet was talking about, well, do we need to change the vaccines? I think a lot of people suddenly were like, wait a minute, but these vaccines were supposed to be great. I think that the vaccines have held up really well in their intention, which is to prevent people from getting severe infections from coronavirus. And And I think when people talk about like breakthrough infections or whatnot, in terms of like somebody testing positive for COVID or having mild symptoms from COVID, but they have that protection, that layer of protection on board, that kind of, whether you boost or when you boost or kind of what you're boosting against, each one of these things, I think about it as being a layer. So I feel like every layer adds benefit though. So like if you have a baseline layer of vaccination in your system right now, so far, particularly against Delta, which is for sure the majority variant still currently around us as we're kind of entering the holiday season, it's really important to like know that if you're vaccinated and if you have a booster on board, or, you know, for the most part, you are in really good shape against severe disease, which is like really why we have this vaccine campaign in the first place. Does that help, Regina?
Yes, it does. It does. But I mean, it's still concerning, of course, but thank you. I appreciate your response.
I think with kids, I'm not sure if oh, sorry. Did you have something to say, Kismet, too?
I was just gonna, again, kind of reiterate what you were saying. I don't think moving forward, the vaccines are gonna be meant to keep you from getting COVID. I mean, totally. It's really going to keep you from being in the hospital and having severe illness and dying. And our latest 90-day, data that we've got from the county, it's you're 13 and a half times more likely to die from COVID if you're unvaccinated in Sonoma County. That's a 90-day average. So that it means a lot. So yeah, you could feel crappy and you're on the couch with COVID, but much better than ending up, with severe illness or dying. So I think that's going to kind of be the mind shift moving forward with the vaccines and COVID.
I think professionally, I'm sure Aaron, Kismet, you guys could probably attest to the fact that like going to work for a lot of people this last year before we had vaccines on board was terrifying, because it felt like, what if today I'm gonna get exposed to COVID, this like totally unpredictable disease, and I'm wearing a mask and I'm washing my hands, but I have to go to work. So I'm going to see people and I'm going to be indoors for more than 15 minutes with every patient that I see. So, and kids don't wear masks because I'm a pediatrician, or at least the littles don't, so I was like, is it going to be today? So the vaccines, what it's helped me with, Regina, in terms of both like the baseline 2 mRNA vaccines and then the booster, which I actually just got recently, it just sort of gives me that like reassurance that functionally, if and when, this sort of like what we're all kind of saying at this point, like when we're exposed to COVID, what layer of protection do you have on board to like reassure yourself that you're going to be okay? So, and just to make sure, I'm not sure if those of you like, it looks like maybe Regina, Valerie, and there's somebody who has a phone number joined with an intention to hear a little bit about kids, because the 5 to 11-year-old vaccine as the new one, I know Aaron's gonna talk a little bit. We were talking briefly before we started about kind of the kind of impact on our community socially, but I think that numbers wise, there are a few things that I say to patients in the office that I feel like helped me, because I have a 7-year-old son, and I got him his COVID vaccine. And I think that when I was thinking about COVID, because the vast majority of kids, and we've been sort of saying this, I think, for the last year, don't really get severe illness. And I think it's important to like acknowledge that. That's like a truth. It's the vast majority do okay with COVID, but not all of them. So for me, I think that when I was thinking about my own kid, and this may be true for folks who have grandkids or, your neighbors and your kids or your loved ones, you want to like kind of do a risk benefit analysis of, again, what are those layers of protection that we have to keep kids safe, particularly since the kids are in school. So, social distancing, in some ways, the schools are going to do the best they can with good ventilation and having the kids eat outside, but it's hard. Kids don't like stay away from each other, and then they wear masks, but when they're younger, they're good at it, but sometimes they're not great. And sometimes it doesn't take that many kids who aren't great at it to start, kind of spreading COVID unintentionally. And this winter has been in pediatrics brutal so far with regard to like even non-COVID infections, all of these infections that we didn't see last year because nobody was in school, with like flu and RSV and all of those viruses that we kind of see in pediatrics. It's really difficult to distinguish like what's COVID and what's not. So everybody's getting tested a lot. And it's just sort of like that kind of mindset of daycares, preschools, and schools are all kind of like difficult to avoid being in contact with other people. So, and how good are kids at hand washing? It's sort of like, so what layers do we have in terms of the children? So I feel like that's where the vaccine becomes huge, because it's just a little bit of a fail safe. You know that at least if your child has a COVID vaccine, when they're exposed to COVID at some point, whether the variants become more infectious or potentially at some point even like are more at risk for affecting kids, you'll have a vaccine on board. So a few things just to kind of say, the studies I think that they did as far as the trial for Pfizer for this age group of 5 to 11-year-olds were like incredible in their efficacy, just like all of the other ones. It's like 91% efficacy in terms of keeping kids safe from getting coronavirus. And just like expected in a study that had 3,000 kids in it plus, really nobody had severe cases. Nobody had myocarditis of those who tested positive in the placebo group. However, the thing that got me when I was thinking about my own kids is that there's this somewhat rare phenomenon, but it seems to mostly affect younger kids, called MIS-C. And it's multi-organ inflammatory syndrome in children. And I'm not sure if those of you who joined the call have heard of it before. It's rare, but when it happens, kids get really sick. And the median age of it is like 9 years old. So my kid's 7. And what happens with multi-organ inflammatory syndrome in children is that you get COVID and you may even have a somewhat mild course, which is, the norm. But a month later, 2 weeks to 6 weeks later, on average a month, the kids start feeling fatigue and weakness. And when you certainly get too weak to eat sometimes, and you check blood work and you notice that like they have like broad inflammation of a lot of their organ systems. And over 8,000 kids have had this in the last 2 years from COVID. And what my hope is that, and the vaccine will just make it so that my 7-year-old won't get MIS-C, just sort of takes it off the table. And by virtue of like dealing with the short-term stuff with vaccines, which a lot of us have dealt with, you have like a sore arm or like maybe even some low-grade fever. It's like a very clear trade-off in my mind. And I know that there's been social media and information that's kind of amplified this question of, particularly in boys, this question of, is there risk to myocarditis, which is like heart inflammation from getting these, the mRNA vaccines. And it's super rare, like just in general, it's super rare. Mostly if you see myocarditis, not from COVID or even from the vaccine, it's mostly in a teenage age group, like which is what they saw even with the kids who were vaccinated, like over 12 years old. And functionally, what we've known from myocarditis associated with the vaccine in its like rarest of cases is that the kids tend to do really well and they get better in a few days. They might be hospitalized because anybody who you talk about anything with heart in kids wants to be observed, but the courses have been like 3 or 4 days of observation, and mostly, even with somewhat like not so invasive treatments, kids get better. In contrast with the MIS-C that I was talking about, where almost 100 kids have died in the 5 to 11-year-old age group with COVID-related complications, and that's not nothing. It's not zero, but it's a small number compared to the over 725,000 like adults who have died. As I think Kismet was saying when we've been following this through the whole pandemic, but it's just not zero. So for me, with my 7-year-old son, and I was like, what do we have as a layer of protection? It felt pretty clear that the vaccine was like anything to take MIS-C off the table and any unknown COVID complication moving forward. And if at some point he needs a booster because we decide as a society that's like the better maneuver for kids, like we think about flu shots, then we'll look at the data critically, just like we do at every level of the game, and kind of go from there. But in my office, that's mostly what I talk about. There have been some allegations, all along the whole pandemic about fertility with the vaccines. I know that that's come up a lot on social media. Same thing. There's really no data to show that there's any difference in fertility rates for people who are vaccinated or who are not. So, those are the two most common things I think that parents say to me in my office. Is with the girls, they say, Brian, are you sure that my daughter's not going to be infertile someday from getting this vaccine? And, all of the OBGYNs are like, please don't get COVID, because pregnant women who get COVID are at a lot higher risk of problems for them and for the babies. And then all the parents with boys say to me, are you sure my kid's not going to get myocarditis? And I'm like, even if they do, as long as they don't get MIS-C, I'm not too worried about them. They'll do just fine. So, Aaron, take the floor, but hopefully that's helpful to you guys who joined the meeting.
I echo your sentiment. I have a 9-year-old. Benefits and risks. Me, my wife, and family, we had the conversation. My son, unfortunately, he bites his nails. He has little nubs on his hands. A layer would be sewing some mittens on his hands while you go to school, but I didn't have that option. And so the vaccine is what we chose. And yes, we are well aware of the myocarditis. I like to think you're more likely to suffer myocarditis from the actual infection versus the vaccine. Okay. And as far as children getting sick, initially, when the virus came out 2 years, I think it was just a mistake that, the science world, we kind of just say, oh, kids are fine. They're going to be all right. We didn't put that much emphasis on our kids right at the beginning. And I think that would cause us to kind of be delayed with addressing our kids. There has been a lot of hospitalization from kids. There's been deaths from kids. Over 650 kids have died since this COVID, based on Children's Hospital of Philadelphia. I like to talk about the impact that kids have when their caregiver or their family member dies. We talk about protecting our kids, but for those kids that are not vaccinated, they are serving as a carrier for the virus to give to their home. Now we're in school, you have this RSV, you have all these viruses popping up. I was sick myself this season, not COVID, but just kids virus. Now they're in school. And so if the kids are not vaccinated, they can carry the virus back into the home and give it to maybe the grandmother who's taking care of them while the mother works, a single mother, or maybe it's the auntie and uncle that's taken over the caregiver role, the caretaker, because mom and dad somewhere came. And so there's a study that was published October 7th issue in the pediatric journal, in which they were reviewing and looking at this phenomenon of all these kids becoming orphans due to the virus. And non-Hispanic whites constitute 61% of our population. They are the majority, while another 39% are minorities. However, inversely, 65% of minorities are more affected with orphanage compared to the majority of white kids. Okay, that could be somewhat of our social culture and dynamics that we live in. But the truth of the story is, I don't know what I would have done or what my mom would have done if my grandmother wasn't available to watch me and my brother while she worked. I mean, it's not just the lost love mentally effect, it's more economically as well. I mean, if you don't have anybody to take care of your kid, what does that mean for a working family as well? And so, I mean, the family structure is so important, especially in the minority family. And these rates are really affected with heavily based community minority neighborhoods. For instance, the southwest border of California and Texas have the highest orphanage among the Hispanic community. If you go to the southeastern states of Alabama, Mississippi, they have the highest orphanage rate of African Americans as well. So you look at these densely populated areas of minorities which are really getting affected. And so I ask parents too, when they think about risk and rewards, think about protecting your extended family as well. Kids, they can get sick and they will pull out of this, but an 80-year-old or 70-year-old with hypertension, obese, diabetes, they may not be able to. Okay, so I just want all of us to really look at how this is affecting the family, not just the kids.
Yeah, I know folks, including family members who are not interested in vaccine. Can you say specific? Okay, hey, let me help you with that a little. Okay, so I've been joined by, over the course of the pandemic, have been working closely with this group called This Is Our Shot, which is this online social media approach of physicians all over the country and other health professionals that are trying to work on messaging. Because I think the question that you're asking is pretty essential, because I think a lot of times, particularly over the holidays, it's like there's those rules like don't talk about politics at like the dinner table, you know. And I think when you talk about things that are contentious but really important to talk about with regard to safety, one of the tools that I feel like we've really worked on, and I actually spent a lot of time doing this in my office, because I think that in pediatrics, one of the things we do a lot actually is talking to parents about vaccines. So it's almost like, I feel pretty practiced in this. And one of the things that's like super important when you talk to family members is to listen first to what it is that they've heard and what it is that they're scared about. And the reason I say that is that a lot of us listen right off the bat to respond, like we're waiting for a keyword to invalidate somebody's comment. You know, you're saying that this vaccine like doesn't, there's, you know, people like look at, for example, like something on social media and it says, you know, there's a vaccine injury, and then you say, no, that's not, it's not real. And the person who says, but I'm worried about a vaccine injury, their actual fear doesn't get validated as being like a real fear of something that's actually really scary. So you're at the dinner table, and or at you said a family gathering, or you have people who you're talking about over the phone, and they're like, man, I don't want to get this vaccine because I don't want a vaccine injury. Take a moment to really hear them and hear what it is that they're scared of. And the missing piece that I think a lot of people don't do so easily and this takes some practice, but when you're talking about listening to understand versus listening to respond, is to say to people, like when they say something super scary, like for example, myocarditis or infertility, like they say, I just don't want my kid to be infertile. It's totally okay to say that, man, if that was actually true, if this vaccine led to something like infertility, I would also be scared. Because one of the things you need to kind of like in communication strategies do is like align on like an intention of safety. So when you could say to them, we both are saying the same thing, actually. We want what's safe for people that we love. And in the echo chambers that they may be living in, it may be that everything they're hearing is terrifying about the vaccine, and they may be hearing nothing about COVID at all, which is amazing to me given the echo chamber that I live in. But I think that just to at least acknowledge in that first moment what it is, like that things that they're scared of are actually scary, and it's okay to be scared of things that are scary. In your role, and I'm not sure, Regina, what your kind of background is as far as like your medical background, but you may not feel comfortable citing data. And I don't think people really want data at this point who are have heard a lot of data and may even be overwhelmed by data. But the thing that I usually tell people who are in the community in this moment of after you've said to somebody, man, that's super scary, I really hope that's not true. Follow that with your own story of if you decided to get vaccinated, or if your friend decided to get vaccinated, or family members, tell them why you decided to get vaccinated. You don't have to tell them to get vaccinated, but at least tell your own story. Nobody knows that story better than you. And when you kind of align on that intention of safety, there are a lot of times when people who love you will be more willing to listen to why you decided to get vaccinated. And maybe even, it may take several times, and I'm sort of making an assumption that you're vaccinated, Regina. Sorry, I hope that's.
Oh, no, I am.
Oh, you are? Okay, you're here. So, but I think that like at least trying not to be confrontational and just understanding of the fact, because I think that when people feel defensive, they can't hear you, even if they love you. because they'll kind of dig in, but I heard that, and you'll be like, so a lot of times when I'm in the office, this is, pediatrician talk now, when parents say to me, Brian, but measles is going to cause autism. Measles vaccine is going to cause autism. I just hear them, and it's really interesting every single time. It's almost like it can be somewhat predictable. It's almost that they get to a point after they've said all the scary things, the people who you love and who you really care about. Once they've said all those scary things, insert whatever, because it changes depending on what's the social media WhatsApp thing of the week. They always get to that point when they actually know that you care about them and that you're listening to them. They always get to that point eventually where they say, what do you think? And the reason they're willing to ask you, what do you think, is because they love you and trust you when you're talking about, family members or people that, you're kind of working with, whether they be at church or whether they be at the dinner table or neighbors or whatnot. And I really do feel like the personal stories matter a lot right now, a lot. And so your story is yours. And I feel like that's yours to tell. And hopefully that in your role, when you're talking to family members, that will play a much bigger role than you may even realize. And I think a lot of, it's almost like with people who are vaccinated, a lot of times it's like a silent majority. There's like a lot of people who are like, oh no, I get vaccinated, whatever. They're not like talking about it at the same volume as the very loud minority of people who feel the need to kind of like try to, fear monger for whatever reason, and they may have that same intention of safety as we do, that they feel like they want to figure out what's safest for their kid or their family member. But I hope that's helpful. So just to kind of summarize this in terms of steps for you, like, listen to understand and be patient, hear all of the things. I sometimes even take notes, just so that they really see that I was hearing them. And then align on an intention of safety and say it out loud. We both really want what's safe here. We both care about each other. And, leading with love goes a long way. And then the last thing, tell your own story. Those are the things that I think have made a huge difference with a lot of these one-on-one conversations in the field.
May I just speak real quick, Regina, from example? Come from a big family, grandparents, 10 kids, over 30, 40 first cousins. Yeah. They trust me from every point of medical question, not just broken bones, from heart related, from brain related. I'm just their doctor. Even though I'm a physician assistant, they'll call me right after their doctor visit and say, do I do this? So yes, there is trust, but I've had discussions, and I'm going to tell you it's going to be an ongoing discussion, because within the African-American family, it's more of validation and trust with just Western allopathic medicine. COVID is just one issue,
Right.
but I have family that don't take their blood pressure medications. I have family that don't take the cholesterol medications. I have uncles that don't get their colorectal exam. I have uncles that don't get the prostates. So for me, it's not just COVID, it's all general health that I speak upon. And to validate what they're scared of, even though their source is some crazy YouTube story, I'll sit there and watch it with them, not to, denounce it or whatever, just really want to see where they're coming from. It's just to validate that they have fears, and we together can kind of really go through those fears together. Now, using your own life experience, well, in my family, we do have a life experience. My grandma, 10 kids, 3 of her kids had polio in the early 50s. And she came from Texas along with my grandfather, post-World War II, high school education. So, learning to trust medicine back then in the 20s, 30s, and 40s, that was really highly unlikely. A lot of Black people tend to go see the Black doctor or so, but she moved to California. Her little baby got polio, and all 7 rest of her kids for sure got that polio vaccine. It's a story that we can learn from, that all of my family know my uncle who died of post-polio syndrome, but this is the story that I really counter them with, and just, it's an ongoing thing. I don't shame them. I don't shut down on them. I just want them to be alive. I want them to prosper. So I kind of wear that on my shoulders as somebody in the medical community for family. I'm just an open book. So whatever their fear is, even though I look at it as like some radical, not in reality facts, I still will sit down and try to go through it and hear their concerns. And if it's not that layer of vaccine, I'm preaching still wear your mask. I'm preaching social distance. I'm just not giving up on them, because ultimately they're going to choose. And I got to respect people's choice, but just don't give up on them. Talk about those other layers. You know, my brother is a year older. He's not vaccinated. I'm telling him every day, where's your mask? Where's your gloves? You know, if you go in the house, you know, wear your mask. So I just a steady conversation with him. That's what I think needs to happen.
Okay.
I'm sorry, I'm going to chime in too then. I've had the same situation in my family. I mean, my family, there's people that it took some time. I think most of my immediate family are not vaccinated, but it wasn't immediate. It wasn't like, oh, we're running out because you said it was a good idea. That was that's where like Aaron said, the trust kind of went away. They're like, you can give us, you know, numbers all day and night, and that doesn't really I'm not sure about this for various different reasons. And it was more of a, okay, you know, when we touched base on phone calls, or, you know, when I got to see people in person, it was a conversation, like, you know, Aaron and Brian were saying, let's talk about what's going on and why you're feeling that way and why I got vaccinated. And it's not just because the CDC said to get vaccinated or, you know, whatever. It was, you know, I had my own personal reasons and things that I was trying to avoid by getting the vaccine. And like Brian said, the risk benefit of for myself and other people that I love and I come in contact with. So it wasn't immediate, but and sometimes it was a mindset. I mean, my brother, he's African American, but he works in he works in law enforcement, and a lot of the law enforcement in the city he works in his office aren't vaccinated. And that was something to talk to him about as well. And like, you've got an office full of unvaccinated people, you're really at a higher risk. You've got a young son, you don't want him to get it. You don't want him to be the person, the child who ends up with, you know, MISC and things like that. And so that, I think, weighed a little heavier on him than himself. He was like, yeah, I don't want my son to get it, and things like that. So it's a conversation. It's a conversation, I think, over time and trying to get there.
Right.
I also wanted to chime in, and largely this might be based on opinion, but I know within the Black community, the issues of mortality are really challenging. And hence why, you know, we don't do the colonoscopies, hence we don't, you know, go for the mental, you know, the health checks, because we're worried about what if something comes back and I'm going to die. So is there anybody doing work around the trepidation or concerns of mortality in the Black community? Yeah, is anybody doing any kind of work, or can they support us in really supporting people? Like, be healthy, get checked out, get the vaccine. It can only help you, and it can only help other community members, but just wondering if anybody's doing any work around that.
So I can kind of say, I wouldn't say we need to do better, I would say, at the health department about addressing that particular concern. But in conversations that I've had, because I've also had that conversation with family members, it's kind of circular. I'm like, you may find out you have, you know, COVID, but we have a higher, you know, rate of death and severe illness if you are Black or African American with COVID. So you want to know, so you can get treated, you know, so you can, you know, it doesn't progress. You don't wait until the point where you're, you know, really in bad shape. And so I really try to, and then that's where I work the vaccine part of it into it. I'm like, no, you don't. We don't want to die. And we have a, you know, higher increased rate of, you know, risk of death and severe illness because of other things like that. We haven't kept up on our, you know, other regular checkups and things that need to be monitored. And so getting the vaccine really is a help for that, to prevent that death and more, you know, morbidity and mortality and things like that. So I try to work that into the fear of death. Okay, again, we know if you're unvaccinated, you have a higher rate or risk of dying from COVID. So let's try to minimize that as much as possible by getting the vaccine and not getting to that point, because it really is circular, because the more Blacks, African Americans that don't get vaccinated, it's the unvaccinated population is now being disproportionately affected by like Delta and whatever the next variant's going to be. It gets to the unvaccinated population and it hits them harder. So then again, now we've got more deaths, and now we're not vaccinated, and then it's like it's just a cycle. And so we're really trying to break the cycle there of higher death from COVID.
In regards to mortality, I tell my cousins and my brother, it's okay if we live past 75. It's fine. Being said that, a lot of us, me included, I mean, we somewhat scored if we live past 18 that's not locked up. I mean, that's how we look at life, like day to day. Urban city or heavily populated areas where I grew up from LA and Compton, if you reach 19, 20, you feel like I made it through life. They don't look at what their 40s and 50s and 60s and 70s are not going to be. They don't even pay attention to that. The time they do start paying attention to mortality is when they get a fatal diagnosis, like, oh, you have colon cancer. And now they're like worried, or I should have got that checked out in retrospect. And the thing I always hear, and I'm, religious, faith, spiritual, well, God's going to take care of me regardless. I hear that all the time. And I'm faith-driven, a faith-based guy too, but it's like, if you walk off a cliff and you say, well, God's just going to give me wings and I could fly, that's not rational. So when they talk to me about their religion and their strength, I'm like, well, maybe spirit moves in different ways. Maybe it's me talking, God speaking through me talking to you. Maybe it's the doctor who's blessed with that mind from the Lord above that's helping you. So I try to really accompany, like, hey, religion is good, but we have to make our own decisions too and be here, and don't just challenge that blind faith is just going to be ignorant faith or so,
Right.
So yeah.
May I ask you another question? I know that we're almost about to end. I am participating with a volunteer group within the county, and we just voted about 2 weeks ago to hold our meetings maskless. I'm very concerned, but it's, I'm wearing my mask, but all the other 18 others are not. And with this new variant, and this is a county volunteer group that's meeting weekly. Our meetings last 2 hours. Can you help me out here in terms of what I can do to encourage a different mindset within this group of volunteers for the county?
Is everyone fully vaccinated?
Everyone, yes, everyone is. And everyone is, the average age is probably late 60s, early 70s.
I'll tell you, hearing that concerns me. I'm very concerned that that's the route, the vote that the group took. I
think one of the things that has been, just to be honest, I think that there's been so much confusion around messaging with, over the course of this pandemic, and it's really been an unbelievable roller coaster. I don't know if it's fair to point fingers at anybody for bad intention one way or another, but I think that if all of us, I'm sure, remember not, it was like, I guess it was May, right before Delta surge, where everybody was like really excited about not having to wear masks anymore if you're vaccinated. We were really excited, particularly like those of us who, just really tired of the N95s. It's really hard to breathe sometimes. And and then we just kind of changed course. And I wonder if in some ways like that kind of precedent where it's like, I'm sure that you all had done the vote to not have masks at meetings like kind of pre-Omicron.
Right, yes.
So things change, and I wonder if like, with Dr. Baldwin's like just kind of help, because it seems like in some ways one of the things that is hard being a health, like kind of in the public forum or like a health professional, is there's this sort of like there's kind of be an example, I think, for others. And I think that a lot of us were, hopeful before Thanksgiving that if everybody was vaccinated in a small group. I know Dr. Mays has presented this multiple times to the Wednesday meetings, like that we all wanted to be like, okay, well, at least, provided that everybody in the group is not going to have severe illness. But I think that when you talk about like the age range of the folks that you said, and particularly as we're saying that overall, it's the just in general, when you talk about who's like the biggest risk group, it would make me hesitant to participate, if I were you. And you may be willing to say that, even not necessarily what's best for everybody, but you might even say, sort of sticking to your own story, like this makes me nervous about my own safety. Like that's an okay thing, I think, to always say when you really are feeling that way in the context of this. And everybody may not agree, but it may provoke another vote, just in a kind of, well, we were hopeful, but maybe now that may not be the smartest maneuver. Or if it's possible that people can attend remotely, so that maybe you don't feel like you have to be in person, even though I know that everything's always better in person. Just whatever you feel like is your own safety. I think we're all kind of taking our own pulse these days.
Okay, all right. Thank you. Thank you for that.
And have courage. Sometimes the one with one mask is the minority, and we kind of don't want to get shamed by all the others who are irresponsible. But like I said, it just takes one person to maybe put some on somebody's mind. And maybe it's other people that think like you are just a little bit too afraid to come forth.
Yes, 100%. I agree with Aaron 100%. I feel like it's so hard to be a spokesperson. Mm-hmm. Even in healthcare with the data, it's so hard. It's a very vulnerable position because it almost is like you're taking a political stance. And I do really feel like it's good to hear like why people have made decisions that they have, including you. You can say that your voice matters in this process. Like it's sort of like right now these days, I feel like everybody has like the permission, I think, to say what it is that's bothering them and what it is that will make them feel safe. And I think that like that'll determine our decisions. Some people have decided to homeschool their kids because they're not vaccinated this year. And every time somebody says that, there's a part of me that's always like, oh my goodness, I understand why you're doing that, but homeschooling sounds really hard from a parent perspective. But I feel like I understand, and it's everybody has, it's sort of like you talk about risk tolerance. So I think everybody has a different risk tolerance right now. And if you're feeling unsafe, I think it's always just like Aaron said, please be brave, but and honest. I think it's there's I'm sure in that group of people that are in there, somebody feels, particularly after reading the news about Omicron, I'm sure that somebody else feels the same way that you do, and they may be scared to speak up. So you might be, somebody may thank you privately afterwards for being that voice.
Okay.
Okay, well, I just want to thank all of you for coming today. We will actually probably be reaching out because this county is really small. We're part of several organizations. We're also part of Sonoma County Black Forum, so we'll be reaching out to you. So hopefully you can do a kind of repeat of this presentation to a different demographic of our community members. But we are so appreciative of the information that you provided, and the candid conversation was pretty amazing. To have the ability to ask the questions and to talk about the different dynamics that are happening in our families of color. So again, we truly appreciate it. I know Regina and we go back and forth. Regina's offering $500
I'll complete what you were saying. I'm offering $500 to my nieces and nephews and family members if they will take the vaccine, if they will take the shot. And only one agreed to do it so far, and I'm still waiting for someone else to take the shot.
I would
That's
think
the
they'd be lined up
Yeah.
for $500. I would
Exactly.
take that.
Kismet, Regina, that's the uphill battle where money's not motivating them. We in for a
You're
long
right.
conversation.
Right.
You're right.
Yeah. It's as
Yeah.
Erin said, it's trust, right? I mean, and trust is earned. You got to really earn it. I mean, I feel like folks who have asked me like, how you can't rush it. You can't rush it. So yeah, you start with the low hanging fruit if money is that, but if it doesn't work, don't give up. Be persistent. I feel like it's amazing how some people, when you ask them like now who are getting their first shots, adults who you say that, why, like why now, what happened? Sometimes people don't have like a logical answer. They're just like, I'm ready. And it's like, okay to get there when you get there. I think that I know that there's going to be things that may rush people beyond their kind of comfort level at some point, but it's like okay to just like be positive. I think that that's really important, and like honor like and celebrate when people are like, yeah, you're safe, like good job, I'm so glad you got vaccinated, rather than like, I wish you had gotten vaccinated earlier. Like stay positive, and supporting each other is like just super important these days. And just like celebrating, I think when people make that decision, whenever a parent gets their kid vaccinated, I try to, it's like from public health, Kismet knows I'm interested in this as well. Like I just thank them for not only taking care of their kid, but also for being another person in our community that's like doing their part to try to keep everybody safe.
Yeah. Well, again, thank you so much. We appreciate it. We will try to get the video back to you, or get the link available pretty soon, as soon as we have some time to kind of edit it and piece it all together. So again, have a lovely Saturday morning, and thank you for donating your time
Yes,
to help community
absolutely.
members.
Yes. Right. Thank you.